Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I develop many procedures for facial rejuvenation, minimal invasive procedure, endo-forehead, eyelid without skin resection. Summarizing, from here to here, I never resect skin. I rejuvenate the full face with carbon dioxide laser. This technique are unique in the world. I receive recognition from my peers. I receive patients from around the world that come to my country. If you see this face, what do you see? Let's see. This patient have no fault. This patient, what is good? This patient have no upper eyelid fat pads. This patient have a sunken eyelid, upper eyelid. A sunken upper eyelid does mean elderness. Also, this patient have a eyebrow ptosis. This eyebrow ptosis mean to have the face with a sad, tired expression. Summarize. The plastic surgeons around the world remove skin from the upper eyelid and get out the fold, but you have this sad, tired expression. And also, in the lower eyelid, they perform an incision here that not only left a scar but also left an ectropion or an sclera show, whatever. The idea is not working in the fold. The idea is to get the face and a nice expression, a beautiful expression, an expression of the youthness. The people must look happy, fresh, and you can see here this and here the opposite. Okay, all around the world perform this technique. Upper eyelid skin resection. With this you get out the fold, but with this you pull down the eyebrow, and pull down the eyebrow produce this kind of face expression, and here produce a scar, but also produce a malposition of the lower eyelid. Here we can see one of the most advanced procedures in the world that you can see marketing all around the world, laser procedure. But this is only a skin resection with a laser. And here, a skin resection with a laser. This is not good at all. Here, in this year, emphasize and broad paré the importance of avoiding over resection. Today, you can see in what is marketing with the most advanced procedure in the world, that is resection with laser, you can see that resect a lot of skin. And this is the resection, and this is the resection, the lower eyelid resection, the damage of the orbicularis muscle, and you can see with this technique many patients with this. Also this big scar and this sad and tired expression, plus a scar here, ectropion here. This is 21 years old that have this sunken upper eyelid plus a sad and tired expression, 21 years old. You can see the sad scar no upper eyelid skin was left, the eyebrow was pulling down, and this is the technique that are performed around the world. And this is my approach to the periorbital rejuvenation. Stop incision here, remove the upper eyelid fat pad, and rejuvenation of all the skin with laser. In the lower eyelid, I perform incision here. In the conjunctiva, I remove the lower eyelid fat pad from here. I do not damage any structure from here because under the conjunctiva I have here the fat pads. I do not touch the orbicular muscle. Okay, and also instead of this is fake. Laser blepharoplasty is fake. This is conventional blepharoplasty, but removing the skin with laser. This is worse than remove the skin with a scalpel, because if you burn the skin with a laser in this situation, you have more possibility of complication than removing with the laser of the scissor, because if you are burning the skin, the stitches can open then this is fake. But it's not fake, but it's the same procedure, but removing the skin with laser. And you are going to hear less coagulation, less bleeding, quickly recovery. This is what must be done. Okay, I'm not going to perform all the video. If the patient comes to my clinic, they do not only rejuvenate the periorbital area, they want to rejuvenate the full face. With a conventional blepharoplasty, this is impossible. I think that it's not possible to rejuvenate a face if you don't use carbon dioxide laser, because you are removing the fold, you are removing the thing, but all the face is with the same wrinkles. Patient love to come to my clinic and perform endoforehead, eyelid without scar, also facelift. But if you perform all this technique and you don't remove the wrinkles, it's not a completely beautiful procedure. Then this is what I'm talking about. Endoforehead I call invisible lift because I never left scar in the frontal area. I developed also this technique that is eyelid or periorbital eyelid rejuvenation with carbon dioxide laser. You can see here all the fold, everything is impossible with a conventionally blepharoplasty. And you can see here, we must to think in the expression of the look. We express with the way we look with this area a plethora of expression. Here you can say this people is happy, or this is tired, this is boring, or this is young, or everything is here. Then we must to think, do not remove a fold, we must to think, improve the expression of the look, the way we present to other people. In here we can see it is not possible to remove skin here, because with this I'm going to probably I'm going to have a sclera show, but with this technique it's impossible to improve all all these wrinkles. All kind of laxity of the upper and lower eyelid and also the malar area can be improved and tightening with the light of carbon dioxide laser. But the professional must to understand the way that the laser acts. My experience is from 1994 to the present. I work with medical doctor from Harvard, Mayo Clinic from Jacksonville. I work with the most prominent people around the world, and I develop my personal technique. I have recognition of most prestigious medical doctors from around the world. You can see in my website all the recognitions, and you can see the change of the face. You can see this, how improve the look. In young patients, it's very important. Never resect the skin, just improve this. You can see the change also in Asia patient, and you can see this full rejuvenation with a natural result, no skin resection from here to here, never remove skin, never left a scar. This is my commitment, what I want to leave in the sciences. This is what I endeavor for the science. Have a nice day.